Thutha wa gũtiriha thabarĩ ya thikũ ithatũ bũrũri-inĩ wa China, President William Ruto ahũndũkĩte na mũciĩ kũrĩa etereirwo nĩ gĩbarũa gĩa gũtua watho na njĩra ya gwĩkĩra kĩrore mendekithia mana marĩa merĩgĩrĩirwo kũrehe mogarũrũku rũhonge-inĩ rwa ũgima wa mwĩrĩ na kũhũthia thogora wa ũrigitani.
Out of pocket costs are decimating families and keeping sick people away from treatment. The new Social Health Insurance Act will now address financial barriers to healthcare and the existing challenges faced by NHIF.
Mawatho maya nĩ wa marĩhi ma ũrigitani, ũhũthĩri wa mĩtambo na nenda ũrigitani-inĩ, ũrigitani wa kũgirĩrĩria mĩrimũ na kwagĩrithia ceceni cia ũrigitani. President augĩte atĩ gũkinyanĩria mogarũrũku maya rũhonge-inĩ rwa ũrigitani nĩ ũndũ ũtĩrĩtio kuma hĩndĩ ya wathani wa President Mwai Kibaki.
Kenyans have voiced their desire for change in healthcare, highlighting high costs and limited access to curative services. In response, we are committed to a community health approach that emphasizes prevention and promotion.
You have been very keen and categorical that a healthy nation gives way to a prosperous nation. So the journey that we have started today with the ascending of the bills will turn around the healthcare architecture for the benefit of the people of Kenya.
For many years, and many Kenyans have given us feedback that they were not able to know what is it that they are covered for. Despite paying 500 shillings, they did not know what their benefit is. We have worked with the team, Your Excellency. Now we are clear on what is the benefit as soon as you make your payment. What is it that you are entitled to? Your Excellency, we have removed exclusions. We have removed limitations that now Kenyans will be able to access services and we shall not be able to leave anyone behind.
President oritie a Kenya matigakorwo na wagagu igũrũ rĩa mawatho maya, akĩruta ciĩranĩro cia atĩ gũtirĩ mũndũ ũtegũcoka kwamũkĩra ũrigitani wa gĩkĩro kĩrĩa kĩagĩrĩire atĩ tondũ ndarĩ na mĩhuko mĩriku, ona thengia marima marĩa ataaramu a rũhonge rũrũ makoretwo magĩtura mũbango ũyũ wothe.
We have no issues completely with the two bills, and that is the digital health bill and the primary care health bill. The other two bills, we will not say exactly we have issues. We only ask that in the state they are in at the moment, they may not be implementable, but the solution would be to have regulations made in the shortest time possible so that we can make them implementable.
It will be possible now, Your Excellency, in due time for Kenyans to be able to have a CT scan in Elwak and have a medical consultant in Kenyatta National Hospital or Nairobi Hospital review that CT scan and be able to advise the healthcare professional back at a health center in Elwak on how to treat their patients.
The innovation of the digital health bill is going to save millions upon millions of Kenyans because many mothers, some of them, have no idea what the doctor said 6 months ago when the child presented to them. And when they have to restart the story, they lose out on very important information, but with the digital innovation, this will no longer be necessary.
President rĩu erĩgĩrĩirwo gũkarugũria ũkinyanĩria wa mawatho maya kũhĩtũkĩra mũbango mwarie wa ũrigitani na njĩra hũthũ kũrĩ Akenya othe mũthenya wa rũciũ kĩharo-inĩ gĩa Kĩricũ thutha wa gũtongoria mambura ma thigũkũ ya Mashujaa. Ngĩribotera Inooro TV, njĩtagwo Wawerũ wa Nyambura.